Prior to beginning the activity, please be sure to review the faculty information and disclosure statements, as well as the learning objectives. After listening to the activity, complete the post-test by clicking the Earn Credit link in the episode description. Downloadable slides and resources are also available. The following presentation is copyrighted by Medscape. No use, broadcast, or recording of this presentation or any part thereof is permitted without the written authorization of Medscape.
The following presentation is part of a certified educational activity provided by Medscape Education and supported by an independent educational grant from Angelini Pharma.
This program is presented by Medscape Education Global.
Hello, I'm Marian Galovic. I'm a neurologist based in Zurich in Switzerland. And welcome to this program titled Achieving Brain Health in Epilepsy, What Can Clinicians Do? We have a great faculty today. Jane, Tori, would you like to introduce yourselves?
Yes, hi, I'm Jane Allendorfer, and as a neuroscientist, I conduct brain imaging and physical activity research in people with epilepsy.
Hi, everyone. I'm Tori Robinson. I'm the CEO of Epilepsy Sparks, podcast host for Epilepsy Sparks Insights, researcher, public speaker, and I have an epilepsy.
Thank you, Jane and Tori, for joining us. So, as an introduction, let me tell you a story about a patient I saw earlier this week. I met a young woman transitioning from pediatric neurology to our adult services, and she was describing low moods, daily headaches, fatigue. She also had occasional seizures. And our pediatric colleagues had recently adjusted her medication. And although she experienced a breakthrough seizure just this week, she told me that she was actually feeling much better, even better than she had in years, because her headaches had almost disappeared, her energy levels had returned, and her mood had lifted. And in her words, her brain felt simply healthier. And that encounter this week really is a reminder that seizure counts, while they are crucial, are only the visible tip of the iceberg. And epilepsy and the way we treat it affects not only seizures, but also sleep, cognition, and mood. And it shapes the participation of our patients in school or work, in friendships, even in romantic relationships, and in overall quality of life. So this session focuses on that broader goal of brain health and how we can reduce seizure burden without really sacrificing cognition, sleep, and mood, how medicines and lifestyles interact, and what practical steps we can take with our teams to help our patients live fuller lives. So, Tori, as a person with a lived experience of epilepsy, what does brain health mean to you?
So, in my specific case, what brain health covers, yes, the epilepsy, but not just the seizure occurrence or frequency, but also the psychiatric aspect. So, as a whole, then, mood, psychological well being. And what does that mean? This means quality of life as a whole. It means my individual behavior. So, how I feel affects how I behave, and that affects my overall quality of life too. We talk about cognitive function as well, especially memory is a huge part, especially in many with an epilepsy, which can be affected by the seizures and the medications and the mood themselves. Then there's also motor functions. So for instance, myself, I'm lucky I don't have a motor function, but many people with an epilepsy do, whether that's due to morbidities like cerebral palsy, stroke, and other types of diseases, or whether it's the medications themselves, whether it's the seizures themselves, and whether it's other things that I haven't mentioned. And then another really important thing is the social aspect of a person's life. We need to look at about what people are experiencing day to day, and how they fit in society, or if they feel they don't fit in. That's really important. And I feel that we can only achieve improving all of these things amongst patients through multidisciplinary teams, through where we don't just see a neurologist, but we have access to a psychiatrist, to a social worker if needed, to a movement disorder specialist, etc. So, because we need accurate diagnosis, specific care, and then lastly is personal acceptance. As it's not very PC to say, but I really do think we need to encourage more personal acceptance of the epilepsies within people who have the diagnosis.
So, those are many important aspects. Now, Jane, what role do seizures themselves play in brain health? And maybe also, do seizures damage the brain?
So, in children, seizures definitely have an important impact on brain development. And in both children and adults, seizures may affect cognition and, as Tori mentioned, particularly memory function, but also sleep and mood. And it is still unclear whether short seizures damage the brain, but now we've had advances in MRI and cellular and molecular techniques, as well as we've looked at long-term neuropsychological data. And these provide evidence for seizure-induced changes in the neural circuitry and networks. So brain damage could also be considered more than just neuronal loss, but also these long-term negative consequences to behavior and cognition. Now, for very long seizures, such as status epilepticus, absolutely they can cause brain damage, and these can be some irreversible effects on the brain networks, brain injury, and also blood-brain barrier permeability, as well as inflammation.
So then one approach to prevent these things may be by treating seizures. But what impact may actually the treatment of seizures with anti-seizure medications have on brain health in people with epilepsy?
So, you know, anti-seizure medications or ASMs are primarily used to suppress the seizures. However, they also may cause sedation, cognitive problems, especially memory problems, as well as mood problems. And this absolutely impacts, quality of life, performance at school or work, and it could reduce their ability to participate in things like sports and social activities. It can impact sleep and also impact their relationships with people. Anti-seizure medications, may also interact with other medications, and with the long-term use, they can interact with the body's own hormones. So, for example, an enzyme-inducing anti-seizure medication can be associated with a higher risk of cardiovascular events, which then in turn impacts brain health. So it can lead to stroke or vascular dementia, and there's also effects on bone health and fertility. Many anti seizure medications have effects on weight. And so, in addition to the anti seizure medication effects and also probably a sedentary lifestyle, there's accompanying risk for health issues and also low level inflammation that can then also contribute to cognitive impairment. So there's a lot of complex relationships between anti seizure medications and other lifestyle factors.
Jane, you also mentioned sleep. So why is sleep essential to brain health? Why is that?
Well, sleep is really central to optimizing our cognitive performance. There are many studies on sleep deprivation that show significant negative effects across cognitive domains, especially when it comes to sustained attention, executive function, as well as long term and short term memory. Sleep disturbances and also sleep disorders have been linked to a greater risk of stroke and also subclinical MRI markers of vascular injury. There's different types of sleep disordered breathing, such as obstructive sleep apnea, that's also associated with other neurological disorders like Alzheimer's disease and related dementias that can be a concern.
So, Tori, from a lived experience with epilepsy, how do seizures, anti-seizure medications, and sleep interact?
Well, poor sleep quality or lack of sleep massively impacts mood and condition, all of which affect quality of life. So, well, first of all, seizures are exhausting. So, although they can make it easier to sleep initially, that isn't necessarily good quality sleep or net positive improved sleep. And then anti-seizure medications can cause sleepiness, lethargy. They can disrupt our sleep cycle. So we might fall asleep at school or work. And then we can't sleep later on. So that can be insomnia. Um, and then some are also associated with vivid dreams or nightmares. Pretty impressive from a Hollywood perspective, but not great for good quality sleep, which then, of course, increases your risk of having further seizures.
Jane, from a clinician's perspective, how do seizures and sleep interact together?
A third of people with epilepsy report at least one sleep disorder. And having sleep disturbance is twice as common in people with epilepsy compared to healthy individuals without sleep. So there's really a complex relationship between epilepsy and seizures and sleep. So sleep deprivation is often a trigger for seizures, right? And not only can seizures be activated during the non-REM sleep phase, but seizures can also disrupt sleep architecture, which then results in poor quality sleep, such as Tori was saying. So ASMs can also negatively affect sleep architecture and sleep quality, and they can cause some daytime sleepiness or insomnia. And an indirect impact of ASMs on sleep is that really some are associated with weight gain, which is a risk factor for sleep disorders like obstructive sleep apnea. So, again, many complex relationships to keep in mind here.
Let's have a look at physical activity, which really is essential to overall health. Tori, may I ask you a question? Well, have you ever been discouraged to participate in physical activity by a physician due to seizures?
Well, not directly to myself as a patient. So when I was diagnosed when I was 10, I didn't hear any clinician say, you can't do this. But in retrospect, I do look back and think I wasn't allowed to swim anymore and I wasn't allowed to climb things anymore. Um, or at least my activity in those spheres was very restricted.
Yeah, but you believe that physical activity has important brain benefits, doesn't it? Brain health benefits.
Oh, just a tad. Yes, immense, I would say. I can say as a person who's had the serious psychiatric part of the epilepsies as well, the without exercise, physical movement of some sorts, I'm stuffed, and we know this is the case for so many patients. I personally find like literal joy, and it's free in walking. I don't have to go to a gym, but I can just, assuming it's not raining like it is at the moment in the UK, I can go for a decent walk, and that makes a huge difference to my quality of life when we're talking about psychiatry, whether we're talking about sleep, and of course the physical aspect as well, like trying to get my steps in. But I would say that people with an epilepsy and their families don't always know how to be physically active safely, and they don't always receive encouragement from their clinician to do so or guidance on how to do it. Also, I think we often presume that if you're going to do some sort of fitness thing, it has to be at a fancy gym, and you have to pay a load of money for it. But that is not true. And we also have to take into account, of course, not everybody has the same physical opportunities or is not able to move their body in the same way. Um, and then another thing we do have to take into account, as much as I love physical activity, is that sometimes the ASMs can literally rob us of the energy that we need to move. Whether it's, they can obviously, as we've mentioned, affect cognition, but also physical activity. It's really, really hard sometimes just to get out of your chair, especially if you feel that you're doped up on medications.
Jane, but what are the risks in people with epilepsy who are considering to doing physical activity or physical exercise?
Well, I really do think that patients and families need guidance on how to be active and what's safe and any adaptations needed. Clinicians really should be aware of the available guidelines, specifically the 2016 special report from the ILAE Task Force on Sports and Epilepsy, published in Epilepsia. So they're able to communicate this to their patients and the patients' families. In particular, I think it's important to let patients know that if they have been seizure free for 12 months or longer, then there's really no added risk to engaging in any type of physical activity or exercise or sports, right? And this report does categorize type of physical activities based on level of risk to the patient and also to people around them should a seizure occur. And it's good to keep in mind that there are physical activities that anyone can engage in with no significant additional risk. And this includes things like dancing or bowling or golf, racket sports, baseball, basketball. Find something enjoyable for you, right? That you can engage in and, be aware that you're able to do those things.
Tori, anything you want to add regarding risks?
I think there needs to be greater understanding of what a person needs when it comes to guidance. Does a patient need to have a parent or a carer with them all of the time? Or are there certain things they definitely shouldn't do? Like, should they be going skydiving every day versus should they be able to walk down the road and meet a friend at a park, something like that?
We need to discuss those things with our patients. So, how can we translate these things and these insights into actions? Now, let me start by encouraging you to actually ask your patients what they want to focus on during your consultation. So, their priorities and the priorities of their family and our priorities as clinicians are not always the same. A quick question at the start of the consultation can be extremely helpful, especially when time is limited. And Tori, I think you have a great example of that to share, right?
Yes, so one of my fabulous podcast guests, Avril Morone from Argentina, she shared this with me. She provides a list of questions or topics, shares those with the patient before an appointment, whether that be through post, email, whatever, and said, what are your priorities to talk about? And then as soon as they get to the appointment, they know what they're going to cover and what is going to mean the most to improving the wellness and the quality of life of the patient. It's that simple.
Excellent. So, next, a few practical points on anti seizure medications. So, patients need to understand the benefits, but also the risks and long term implications of taking anti seizure medications. And as clinicians, we should aim for the lowest effective dose, and patients should try to take their medication exactly as prescribed. Now, you should also be thinking about ASM withdrawal when it may be safe. And when you choose anti seizure medications, we need to weigh efficacy against adverse effects and also consider which effects are particularly important for that individual. So, whether there might be beneficial off target effects. We also need to monitor side effects proactively, for example, with validated questionnaires, and we need to adjust treatment rather than just letting inertia take over. And finally, we need to remember interactions with other long term medicines, such as antihypertensives or statins or anticoagulants. So, choosing wisely and with the whole patient in mind really makes a difference. Now, let's talk about sleep. Jane, can you give a couple of advices regarding sleep?
Yes, I really think it's important to monitor sleep quantity and quality. And, as you mentioned, validated questionnaires, there are some available related to sleep that can be sent to patients before appointments, or you can ask about it during the appointment itself. Something as simple as, have you felt sleepy during the day? And so if they answer yes, follow things up with something like, how many hours do you sleep each night, or do you feel rested when you wake up in the morning? And these can really guide, the conversation.
It's also important to know that you do not need to do everything yourself. You can refer early to sleep specialists or arrange counseling for sleep hygiene. So it's really helpful to have strong ties with sleep specialists in this regard, I believe. Now, what about physical activity? Jane, what would you suggest to patients in regards to maintaining a good level of physical activity?
Well, definitely, I would encourage physical activity when it's safe and depending on a person's abilities, right? But definitely encourage more activity. So, for example, if you have, less than 150 minutes a week of physical activity, which is the general guideline, or less than 5,000 steps a day, one thing is to encourage to gradually increase and maybe set some specific goals that are definitely measurable and achievable, and time bound. So, you can do some goal setting. For example, if it's low, like 1,000 steps a day, then you can encourage them to gradually increase by 500 steps a day, and do that for a week. So nothing immediate or drastic, just gradual, just something to keep moving. And also find something that you enjoy doing. And it doesn't have to be like Tori said, you don't have to go to a fancy gym. You can do things around the house, play some music, dance around. You're moving your body. And I think that is, the best type of physical activity.
Yeah, enjoyment is important. Tori, do you have any suggestions of enjoyable activities that you could suggest to our listeners?
Yes, yes, I do. And, enjoyment, I was going to say also fun, actually, as much as many of us don't actually like the thought of exercise, but it can be fun. Even chasing my cat around the apartment is fun. But also, more seriously, we need to look at things like the things from the monetary perspective of many patients cannot even afford a gym, right? Or they are not close enough to a gym that they can walk because many of them can't drive. So what can we do on our own? And there are so many things that we can do, whether it's cleaning the house, you don't have to hire a cleaner, whether it's going for a walk, whether it's doing crazy speed walking like myself, apparently that's an Olympic activity. Um, and you can also, if you're not sure what to do, you can find the stuff out for free. You can find all this free guidance out there. So there's a lot of stuff that you can do on your own, and just I would say just take it step by step, and don't expect oneself to be the new Usain Bolt or anything. It's just take it step by step.
Okay, so to close, brain health in epilepsy is shaped by much more than seizure counts. Seizures, especially the prolonged ones, are definitely part of it, but so are the effects of anti-seizure medications on cognition, mood, sleep, etc. And sleep quality itself matters, as does physical activity and social participation. And all of these factors really interact. So, practically, we can make a real difference with a few simple steps. We can review medications regularly to reduce cognitive or sedating burden and to avoid enzyme inducers whenever possible. We can screen for sleep problems and mood symptoms and treat them proactively. We can also encourage safe physical activity with a clear guidance. And we can set goals that reflect what patients actually want for school, for work, relationships, and also for daily functioning. And I believe if we measure what truly matters, not only seizures, we help our patients live fuller and healthier lives. Tori, Jane, thank you for this great discussion. And thank you for participating in this activity. Please continue on to answer the questions that follow and complete the evaluation.
This program was presented by Medscape Education Global.